So why am I the best person for you to go to? Well, I've been through this. I've done it. I've become a certified hand therapist years ago, and I've worked in many different settings. And now that I work in my own private clinic, right? When I work in my own private clinic, I have a very unique perspective of what is required to be able to not just study, but study in a way that you can apply everything you know and be able to answer any question that comes your way. And I've been doing it for the last over 5 years, because I started hiring my therapists. I've been in business for over 10 years, started hiring my therapists, started teaching them ways in which to critically think through, problem solve, and make the best decisions when it comes to being able to help their patients. It is not cookie cutter. It is not just about a protocol. It is not just about following whatever the doctor's orders are, because listen, I just don't have access to that. I don't have access to all the stuff from a big hospital. Doctors aren't just telling me what to do. I have to figure it out, and I've had to teach my therapists how they can figure it out. I've created programs. I've created frameworks to help my students, my staff first. So I've tried it out on my own people first, and then I opened up the program over 5 years ago. I've been able to help therapists pass in a way that's easier. They've been thinking for years, and now they're in the program. They hunker down and get it done in 6 months. Sometimes people take a little bit longer, but that's okay. They're still working towards their goals instead of just like giving up. I've helped people who have failed in the past be able to achieve a success score and be able to become a certified hand therapist, even through all their frustrations. You know what is also more important? It is not through just success. So a lot of people are going to be like, well, what's the success rate and blah, blah, blah. Let me tell you, we learn through our failures so much more than we learn through the success. Yes, there's success in the program, but because I've been able to see and get such in-depth knowledge of when people do fail, I can help you to navigate what not to do. That's going to help you so much easier and faster. So now I'm going to address some common questions that I get about my program and myself as well, being the certified hand therapist.
Can you talk about the specific challenges that you faced when you were preparing for the CHT and how those experiences help you shape the program that you have today?
Okay, my experiences as studying for it. It was extremely daunting because I did listen to other people's stories. I'm sharing that with you because I listened to them. I had a supervisor who told me that he took it and he failed and it was so hard. And when people say that, they have a little glimpse of like, if I couldn't do it, you shouldn't be able to do it either. And I know he didn't like necessarily mean it that way, but that's what he meant. So I started studying, and it was really the Rehab of the Hand book. Oh my gosh, I have it right here. It's so dry. I mean, there's 2 volumes. It's so dry. It was really hard to get through chapter 1. And it's funny because the way it's broken up, like I understand the people who wrote the book had to put the volumes and the chapters in the way that they did, but I break it up in a little bit of a different way to then be able to help chunk out the information. And when I studied for that, I didn't have that. I was just reading like chapter 1, chapter 2, and then feeling like I didn't understand anything. Like anatomy and kinesiology of the hand, anatomy and kinesiology of the wrist. And I'm reading these things, it's still the same. Anatomy doesn't change, right? Anatomy doesn't change. It's still the same boring shit. And you're reading it and you're like, it makes you feel dumb. It really does. It makes you feel dumb. Like I've had therapists tell me like, I've been practicing for so many years, and they know what they're doing. It's just like when you start to read these books, the language they use, the words they use, the way they put these sentences together, they're making it hard for no reason except for to help them sound smarter, right? So my program chunks up the information in a way that makes it easier and breaks it down so that you can understand in an easier way. I didn't have any of that when I was studying. So I'm literally creating this program for my 20-something-year-old self, for the Huang when I was moving from acute care into an outpatient setting and not knowing anything, moving into a setting where nobody was going to help me. The CHT had left, the therapists that were there, they have their own job, they have their own lives. They had no interest in sitting down with me and lecturing, and showing me what they knew, because not everyone necessarily wants, like, we weren't friends. I mean, we're friends now, but back then, I took the position she wanted. So why would she like sit down and like teach me everything she knows, right? She didn't have that kind of time. And so I didn't have that. I didn't have that kind of support, and I created my program for that past self. I also created this program for all the therapists who come to me and tell me, hey, like, I don't work in a supportive environment. I don't have people I can talk to and ask, I don't have the experience that everyone else, quote unquote, has. And so, yeah, I work with hands and arms, but I'm not seeing a ton of post-surgical cases. So I've created this program for that person and for my past self. So if I had just had it just a smidge easier, I don't think I would have been so hard on myself. I wouldn't have been so like mean to myself. Probably could have done that shit faster too. It took me a year to study, and back then the exam was only given once. It was only given once a year, and so if you didn't take it, you had to wait a whole another year. So my thing was, I was so frustrated with my job, my position, that I was like, screw these people. I have the years, I have the hours, I'm just going to start studying, because if I start studying, I know that that's going to move me into the direction of my career that I wanted. And you don't really get a lot of help. Like, majority of therapists, you're chucked out there and you don't really have a lot of help, right? So when I started with that idea in mind, but I would lose so much momentum. I lost so much steam because I would sit there and read chapter 1. I would read in bed. Girl, I was falling asleep. I could not keep my eyes open with, the type of language that you're just not used to in the clinic. And so I would start on a chapter, fall asleep, feel discouraged, quit for a few weeks, start again. And then I had gotten so tired of myself. I was just like, this is stupid. Just keep going. And then what happened for me was, because I set that intention out there, I believe I set that intention out there. I started looking, but an opportunity came for me. And when the opportunity came for me, I went in there because I was already with the decision made. The decision was made to start studying to become a CHT, even if I hadn't done everything. The decision was made. So when I went to that interview, I was like, I'm going to take this exam whether you give me this job or not. I'm going to pass. And the idea was, I was going to take myself to the marketplace and see, now there's a bidding war. Who wants a piece of me, right? So so that's essentially what I did when I was preparing. But it was tough. It was not easy. And this program, the exam prep program, is created to give the therapist the support that they're looking for, give the therapist the support, therapists now, the support that I didn't have back then.
How have you personally helped therapists achieve success with your program?
I've personally helped therapists through my clinic first, right? So through my clinic, I've hired therapists, I've trained therapists, I've helped them study to become a certified hand therapist. I've given them not just the knowledge, but the clinical reasoning and problem solving of seeing the patient, taking the information, applying it right then and there, and helping them have the confidence to take the exam either for the first time or taking it again if they have failed in the past. And then I took that program of what I started doing with my own patients, and then I started to reach out to more and more therapists from around the world, and I've been able to help them. I've had students from Africa, I have had students from the Middle East, I've had students from the UK, I've had students from Canada and all around the United States be able to sit through this program no matter what time zone, no matter their healthcare system. Because here's the thing, when it comes to the CHT, it's not about your healthcare system. It is not about where you live in the world and how often you see somebody. It really is about being able to problem solve through any case that comes your way. People are going to have hand and arm injuries no matter where they are, and I've been able to help those therapists, study in a way that helps them to be able to answer these questions and to be able to pass. Now, what are the results that they've seen? They've been able to get better job opportunities. They've been able to move and showcase without having a reputation already that, hey, I can do that job, right? And then I've helped therapists be able to switch jobs once they get the CHT. If they were unhappy or they just wanted a different opportunity, maybe they were happy, but hey, something new came along, and it was at the right time in their life. Because they had their CHT, they had those opportunities approach them versus always looking for it, right?
And what separates your CHT program from others in terms of the level of support, guidance, and expertise provided?
So what separates my program from other programs is that once a student enters my world, they have access to me, right? They have access to me, and I teach them within the program how to send the email. I usually respond within 48 hours or less to their questions. And it's not just a quick question, but it's really to help them, one, to think through whatever, if it's a case or if it's about studying about a particular topic, so that they have a more in-depth understanding. So it's not just a quick yes or no. It's like the help that I provide is always, especially inside the exam prep program, my number one mindset with that program is like, how can I help you so that you're constantly thinking about, I'm going to answer these questions correctly. I'm going to be able to figure it out no matter what the question is, because the questions constantly change, and you're going to have to be able to answer those questions, whether you actually 100% know it or not. You're going to be able to figure it out. That's what separates my program. So outside of just the email support, I also give support via Loom videos. So usually if someone's asking a question, I can break down their questions and share with them a little video. And then I also think that when you're in a group format, your question, you learn from other people's questions. So I take a lot of my students' questions and share it to the group so that everyone has that continued learning. So I'll take questions, and when we do live calls, we'll discuss those questions. So it's not just like a quick answer, it's more an in-depth answer so that everyone can learn from one person's questions. So if you're wondering, like, can I become a certified hand therapist? Of course you can. I'm an occupational therapist, and I doubted myself years ago, and I became a certified hand therapist. If I can become a certified hand therapist, you can become a certified hand therapist. I've been a certified hand therapist, or a therapist in general, for over 25 years. Can't believe I'm saying that. That's always like, wow, how did that happen? But if you want to learn more about what you can do to become a certified hand therapist as well, with the support and guidance of my program, please come join me on my free live masterclass. It's October 29th, 7 p.m. Eastern Standard Time. The link's going to be below. My exam prep program is open October 26th through November 9th for enrollment. If you want to learn more about it, you can also click the link below and apply for the exam prep program. It's not to say that you're saying yes. It's not to say I'm saying yes to you. I do look through and make sure that this program is the best fit for you. So if you're interested, all the links are going to be below. All right. Come join me though for my free live masterclass, because I'm going to help you plan out your studying so that it's easier, faster, and totally doable. And it's an opportunity for us to get more personal. It's usually a small group of people. You can have whatever questions you have. I'll be able to answer them for you.